In the middle of a global health crisis, a single political move sent shockwaves through the front lines of disease control: the U.S. withdrawal from the World Health Organization. While the decision was framed as a protest against mismanagement and geopolitical influence, the real-world fallout was felt far from the halls of Washington. When the Hantavirus outbreak hit, the cost of isolation became dangerously clear. By stepping back from the WHO, the U.S. essentially disconnected its radar. Access to international surveillance data, the lifeblood of pandemic response, slowed to a crawl. This wasn't just a bureaucratic hurdle, it meant health officials were flying blind. The cruise ship cases served as the ultimate stress test. Cruise ships are floating international borders. Containing an outbreak on one requires a seamless, synchronized global effort. Without direct, real-time access to WHO networks, U.S. officials struggled to coordinate with international partners. The result? Critical delays in contact tracing. In the world of infectious disease, an hour of lost time can mean dozens of new infections. This sets a precarious precedent for global security. Look at Southeast Asia, a known hot zone for zoonotic diseases. Countries like Indonesia and the Philippines don't just benefit from global information sharing, they survive by it. When the world's leading health power steps out, it doesn't just weaken the system, it creates a vacuum. We have to ask, who benefits from a fractured health infrastructure? While the WHO certainly faces legitimate calls for reform, total abandonment plays into the hands of those who thrive on chaos and the erosion of multilateral trust. Authoritarian actors often exploit these cracks to advance their own agendas, leaving sovereign nations more vulnerable, not less. The lesson is stark. Global health crises demand collaboration, not isolationism. Southeast Asia, with its dense urban centers and vulnerability to both viruses and disinfection,